Hello everyone. So let's discuss how you are going to approach for surgery, especially for INICET. When 39 days are left, you are going to at least get around 35 questions from surgery. Now, for all the purposes, I have divided us into two broad categories, that is who once have read the subject and those who have started to read the subject. Before I give any of the advices, just remember these 5 points. First, surgery in the MCQs is more clinical. Please, surgery is very basic subject, right? We think it is very complicated, but it is a very basic subject. We have to mark the answer, whatever we have observed in our internship. Please think as a doctor at that point of time, not as an aspirant or as a student while solving surgery questions primarily. And also, questions are going to test your clinical skills. You have to believe in your first instincts when you are solving surgery questions. Okay, so for all the purposes, let's see how you're going to approach surgery ideally. So divide surgery into 3 broad categories: general, systemic, and then the instruments. Now, please focus more and more on general surgery, then on the systemic, and then on the instruments. Now, whenever you are talking about the general surgery, please remember entire surgery, if I say about INICET, it is all revolving around trauma. And it will yield you around 8 to 10 questions in INICET pakka pakka. Next, very important is breast. Please go through breast, and Dr. Rohan Khandelwal has taught breast very beautifully. You can watch his RR videos and you are done with the breast topic. Please remember breast TNM classification is something which is very important. And also the BIRAT scoring and the molecular classification, which is very, very important. You can club this with pathology also. Next, thyroid. Thyroid is again a very धीरे-धीरे उबलता हुआ topic है. This time in INICET they asked around 1 to 2 questions on thyroid, especially the thyroid surgery. Please read thyroid cancer by heart, club it with anatomy and pathology. Also read the embryology of thyroid, which is very important. Then coming to the sutures, and very important, focus on artery, veins and lymph node. They will give you direct questions from artery, veins and lymph node. In the last 2 NEET, I remember there were 2 direct questions on seep classification for varicose veins. So this is one of the very favorite topic. Along with that, hernia. So in these major subjects like gynae, surgery and medicine, you have to be very particular और बहुत selectively पढ़ना है, बहुत smartly पढ़ना है. For example, if you are reading it in surgery, you have to target small topics that will be पक्का पक्कास. There will be no question paper जहाँ पे artery, veins and lymphatics नहीं पूछा, या hernia नहीं पूछा, thyroid नहीं पूछा, breast नहीं पूछा. They will ask you, so read these first, ना, cover all these bang questions first and then go for the other topics. Please focus on these small topics which are very important. Then go for the systemic. Now, when you are doing the systemic, please remember it is my perception, you should first go for genitourinary. Since the last 2 to 3 years, they are continuously asking so many questions on this topic, and this is very easy. Next, please go and read hepatobiliary along with pancreas and spleen. This will definitely yield to 2 to 3 questions for sure. Then come to the salivary gland and CVS and lungs. Then at last, please go for GIT and club this with anatomy, pathology and radiology. Coming to the instruments, all the drains should be remembered, and the other instruments can be seen either from BTR or from Marrow. Dr. Rohan Khandelwal sir has done a very good job. Along with that, Dr. Nishant's YouTube video of around 1 hour 34 minutes is there. You can watch it in 2x also. Many of the instruments he has covered. Please club all the cancers in the TNM staging with management at one place. So please solve more and more questions. Focus on all the 3 domains that I discussed: general, systemic, as well as instruments, and do not forget to revise general surgery in the last 3 to 4 days. Now, for those who are still to start surgery, there are 39 days left. You can either go for 3 days BTR or RR. If you can do that, it's okay. If you're not able to do that, I would just suggest you that you only focus on the trauma part, general surgery part, along with the PYQs from the systemic, and instruments on the last day you can see. This is something how you're going to approach for surgery in this next 35 days. So please keep studying. Thank you so much. Bye.